Hello friends, this is Dr. Nasriyal and welcome to the other video of Alaa Notes. In today's video, we are going to discuss infections in pregnancy. So the first question is female patient came with left leg pain and swelling with red streak. So red streak means there is some kind of cellulitis or lymphangitis. So in both of these cases, the commonest bacteria is either Streptococcus pyogenes or Staph aureus. So in any of the cases of cellulitis or lymphangitis, you have to choose Streptococcus pyogenes or Staph aureus because they are among the normal flora of the skin. So next question is female used herbal cream in vagina then started to have redness and itching. So the question tells that there was no itching or redness in vagina before the use of the cream. So after female used the cream, she got this redness and itching. So the answer is contact dermatitis over here. So now we are going to discuss the infertility part of the questions. So in this question, he asked couple came to a fertility clinic. The wife had PID 2 years ago with chlamydia and got treated. The husband's semen was normal. What is the appropriate step? The right answer is IVF. Now here the important point to note is whenever they ask the PID and the infection is chlamydia, then you always have to consider that there is an adherence of the adherence of the tube because chlamydia infection causes scarring of the tube, and due to the scarring it leads to the adherence or obstruction of the tube. So due to this cause, the couple had to get the IVF treatment for fertility. And the other question is female with her husband for fertility counseling, her BMI and all labs are normal. Regular menses are there. So what is the best advice? You have to advise eat less fast food. So the other question is most significant examination in gynae for general checkup in newly married women. So here you have to remember one thing. If they ask most significant examination, then it is pelvic exam. But if they ask what is the first thing to assess, then you have to do general appearance or general physical examination. So suppose a question asks you the newly married couple came to your clinic for infertility checkup. What will be the first thing to do from the doctor? So the first thing to do will be the general physical examination. So if the question asks what will be the most significant thing to do, then you have to do the pelvic examination. This is very important. So here also he has explained that general appearance of the couple might help you reach the diagnosis for infertility. For example, there may be hirsutism in the female or female support. I don't know what is this. There might be lymphadenopathy or parotid enlargement. So if on the general appearance there is lymphadenopathy or parotid enlargement in the male, then there might be a case of orchitis in male, which could be the cause of infertility. So the next question is couple come by for infertility after investigation done shows bilateral fallopian tube obstruction. So this is the question about the counseling. So you have to tell both of them about the disease, that both of the fallopian tubes are obstructed. You have to counsel both of the couple members of both of the members. Infertility and cysts in ovary. What is the problem? The problem is ovulation because there is infertility, and the question also tells that there are cysts in the ovaries. So the infertility is related to ovulation problems, ovulation causes. So next question is couple seeking infertility clinic after 3 months. What will be the advice? So now the new guidelines are if the couple is married for at least 1 year and they are unable to conceive, then you will label them infertile. Before it was 2 years of the time duration after marriage. Now new some book says it is of 12 months or 1 year. So you will advise them try more because there are only 3 months have been from since their marriage. So after how many months you will start call a couple infertile? Here is the answer: 12 months. Wife with Down syndrome, husband tried to conceive for 3 months. So here the 3 months is only the duration of the marriage. So you will tell them try more and come back after 1 year. Couple present with 3 months infertility. The next step would be nothing because the duration is only 3 months. So this is very important. You have to remember this. Couple after 2 years failed to get pregnant. Now 2 years have passed and they are failed to get pregnant. Husband's sperm count is normal. What is the cause of infertility? So the after you have ruled out the general physical examination, and after you have done pelvic examination, and after you have checked the semen analysis, all of these are normal. Then after all of these, the most common cause of infertility would be the ovulation causes. There might be an ovulatory cycles or something like that, so you have to look for ovulation causes. So the couple came to infertility clinic. Semen analysis was normal. Cervical exam not done yet. The wife has regular menstrual cycles of 36 to 40 days. This is not normal. 36 to 40 days. This is not normal. Investigation shows monophasic basal temperature. So what is the cause of infertility and ovulatory cycle? So female complain of infertility for 2 years. The duration is more than 1 year. Now 2 years have been passed after for their infertility. The female has regular period, normal semen analysis. This is a clue: monophasic basal body temperature. So what's the cause of infertility and ovulatory cycle again? So woman in her 30s with irregular cycles and an ovulatory cycle. So the question has given you the clue. An ovulatory cycles are there. There is also a history of infertility, and the endometrial biopsy shows atypical hyperplasia. So what would be the treatment? Now they are asking for the treatment. The treatment would be oral progesterone. So this is important to understand here. Since the progesterone is made by corpus luteum, so if there are an ovulatory cycle, there will be no ovulation, so there will be no formulation of corpus luteum, so there will be no production of progesterone, which leads to endometrial thickening and ultimately the menstrual cycle. So in the absence of progesterone, you have to give externally oral progesterone in the case of anovulatory cycles. So the couple present to infertility clinic. Everything was normal after taking history and doing examination. Which first investigation to do? So which first investigation would you do? We look for the causes in male. The most common thing is first look for male. If the semen analysis is normal in male, then look for the female causes. This is very important. So female with regular menses come for infertility evaluation. So you will if there are menses are regular and still they are infertile, you will give progesterone. I didn't understand this question, but they have given here the clue in monophasic basal body temperature, I think. But if you any of you understand this question, then tell me in the comment section. Couple came to you with infertility issues. Upon investigation, wife has bilateral tuber blockage. So who should you inform? This is again the counseling question. You have to inform both. So the couple present with infertility for 3 years, what you will order? So the choice would be semen analysis. You have to start from the male. Then if the male results are normal, you would proceed for female investigation. Patient came to infertility clinic. Now again here is the clue: wife has PID, pelvic inflammatory disease in the past. Everything is normal what to do now. If they have mentioned pelvic inflammatory disease, then you have to understand that the chlamydia is the most common cause in pelvic inflammatory disease and it causes adhesion, so you have to go do hysterosalpingogram first to rule out the cause of infertility. So pregnant lady gravita 4 para 35 years old, 30 now her gestational age is 34 week, came complaining of bleeding for 2 hourly. So what question would you were asked for about the recent intercourse? So suppose if they say there is no history of intercourse, then you would look for causes of vaginitis, cervicitis, or the cause of cervical CA, like this. If there is no history of intercourse, then you will look for vaginitis, cervicitis, or cervical CA, herpes, warts, things like that. So the question is history of chlamydia infection, wants to get pregnant. Again, you will do hysterosalpingogram.